From wherever you are around the world, welcome and thank you for joining us. Today we're going to be exploring Asperger's syndrome in a different way. Today we're going to look at a man's quest with an Asperger's diagnosis to improve his marriage. With us today is David Finch. He grew up in a farm in northern Illinois and attended the University of Miami. In 2008, he was diagnosed with Asperger's syndrome. He wrote a wonderful book called The Journal of Best Practices, a memoir of marriage, Asperger's syndrome, and one man's quest to be a better husband. So let's welcome Mr. Finch to the circle. Welcome, Mr. Finch.
Thank you.
So this is actually a wonderful book, and it's actually really humorous in a weird way. I see a lot of my marriage, and I think a lot of people can see their marriages in your book. Can you give us a little insight of why you wrote the book, first of all?
Absolutely. The book was something I wanted to write. It captures this 2-year period in my marriage where my wife Kristen and I worked really hard to basically reclaim our marriage and to reclaim our friendship after I was diagnosed with Asperger's syndrome at age 30. I think what the book does is I wrote the book to be funny, to tell a funny story about our marriage. I wasn't expecting it to resonate the way that it did with certain audiences, and I think what I've learned here in the last couple of years is that it really provides a realistic day-to-day account of somebody who's just trying to navigate life as an adult who grew up with processing things differently, with certain challenges in socializing with people, and not really understanding why things were so different for him, and finally learning and getting all these answers well into adulthood. I think the other thing the book does is it really resonates among married people. I think it paints a pretty accurate depiction of the sorts of things we all deal with in a marriage, that we all struggle with, and maybe in my case amplified a little bit or magnified, just because of the sorts of things that I have to deal with, and by extension the sorts of things my wife has to deal with.
Let me ask you this question. Now, why did you go get tested? If I can even talk. Did you go get tested on your own volition? Did somebody recommend it? Was it something what happened there?
That was funny you ask. I was so my wife Kristen at the time, and this was several years ago, about 7-8 years ago or something now. At the time, she was a speech therapist, and she was working with children with autism, and she had started working with kids more with Asperger's syndrome, and then meeting their parents. And once she started working, with these kids with Asperger's and meeting their parents, she thought, "Oh my gosh!" And so she sat me down one evening, and it kind of connected some dots in her mind. But she sat me down one evening and conducted a very informal Asperger's evaluation, which I seemed to pass with flying colors. She was not expecting that. She didn't know that she was going to be sitting down and essentially diagnosing me with Asperger's. She just wanted to see what my answers would be. Anyway, so after we took that thing, then I went and talked to a psychologist, and the psychologist said, "Yeah, that's that's Asperger's." So I wouldn't have thought to go and look into this or anything. I never had any inkling. I was always just okay being kind of on the periphery of normal society, looking in from the outside, and that was always fine with me.
That's something, too. I think a lot of people don't realize that autism and Asperger's are on a spectrum. And they don't have all the same characteristics either.
Right, exactly. And it is, I think, to varying degrees, certain characteristics will affect, people in different ways. If it's a spectrum sort of thing, then it can be argued that we all have these characteristics, these sorts of issues. Now, I'm certainly not claiming that in my case, my experiences mimic or parallel the experiences of somebody who would receive an autism diagnosis, who might have certain impairments in certain areas, who might have kind of more self-injurious behaviors and meltdowns, that sort of thing. That hasn't been my experience at all. And I think that's where you start separating along the spectrum, levels of severity, maybe in different in different ways that it impacts you.
Let's explore that a little bit, if you don't mind. What are some of the salient characteristics that you spotted and you said, "Oh, that's definitely Asperger's," and some of the ones that you don't have, maybe society says or believes are typical?
Yeah, no, I think I think in my case, speaking about my own experiences, and things I'm able to observe now as an adult would be more things like persistent and intense preoccupations with certain things that aren't always, and I would just say almost never, in line with the sorts of things that the world needs from me or expects from me. Um, my kids wanting to spend time with me while I'm just intensely focused on teaching myself how to juggle for no reason. I'm not in a circus. Like there's no real benefit to learning. I got in my mind one day that I figured I could teach myself, and I missed about 3 or 4 months of my son's development. He was a baby on the floor, and then by the time I got done teaching myself how to juggle, he was walking around. There's that sort of thing. There's I think one of the big ones for me personally is clinical, what I call clinical strength egocentricity. So not egocentric thinking, oh, I'm awesome and everybody should worship me, which I am and they should, but it's more thinking, not remembering to step outside of my own self and my own experience, and not realizing all the time that I need to consider somebody else, that they have their own point of view, their perspective. I can remember to force myself into their shoes and kind of surmise how they're feeling, but I'm probably not automatically going to do that unless it's either by rote or by memory or whatever.
Interesting.
Yeah, and like I said, I think that certain things like this, unusual mannerisms and behaviors, you can't always spot somebody with Asperger's if you're just like on the train looking around. But if you talk to somebody long enough, you start to realize, like, okay, I think I know who I'm dealing with here. But the same can be said for anybody. I've had so many times where I've been flying somewhere to a speaking engagement, or a meeting, somewhere, and I'm sitting next to somebody on the plane who won't stop talking, and it's about something that completely disinterests me. They're not getting the cues, and you wouldn't diagnose them with Asperger's. They're just a fun-loving, sociable person, but it's like, dude, mind the fact that you don't really have an audience right now. So we all miss these kind of cues. It's just, in my case, it was some things that were starting to limit, what I could do in my career. It was starting to limit what, how engaged I was with my family. And for me, that wasn't okay anymore. I wanted to be able to do better and do more things and be more engaged and present. And so that's why I started learning about the parameters, the characteristics of Asperger's, and how I can do better to kind of learn the more social behaviors that would kind of help me integrate more in my family and in the world around me.
I think a lot of guys have that challenge as well, trying to engage their family more, be more involved. We get busy with work. We have other things in our head.
Right.
So, yeah, I think it's independent of Asperger's or not, it's been a big challenge for guys.
Hello, my name's Matt, and I'm an addict.
My mom was addicted to prescription pills when I was very young, before I even turned 1.
Are you or someone you know struggling with alcohol or drug addiction? Has everyone given up on you or your loved one? The caring staff at Elite Care understands and treats you as a whole person. We offer individual and group therapy, holistic healing such as yoga, nutrition, and spirituality, medication management, and PTSD treatment. By building upon your strengths and rebuilding broken bonds, we help you begin a successful life. With our staff of licensed psychotherapists and doctors, you can be assured of the highest level of care. Elite Care is the best option for long-term rehabilitation from drugs and alcohol. Contact 888-511-0607 for more information.
That's the wonderful thing about your book, is you talk about some of these challenges that we all face as men. What were some of your solutions? What are your stories that you really stood out for you when you wrote the book?
Well, the book came down to, the way that I structured this thing, it's called the Journal of Best Practices, because my method when I received this Asperger's diagnosis, I thought I connected the dots in my mind, and I said, my marriage is unraveling. We got this mild form of autism. There's probably a connection here. And so basically I started looking for ways that I could improve as a husband and as a father. And some of them were related to Asperger's, things like, remember to kind of pay attention to, your wife's needs without her always having to bring them up, put yourself in her shoes a little bit, listen more intentively, listen with some empathy, that sort of thing. And other things were completely not related to Asperger's at all. Like, don't just take what you need out of the dryer, fold all the laundry. Just, being a good partner. What I decided was, okay, I want to do better in these areas. And so I sat down, and anytime something would come up in our marriage that I wanted to improve and or fix, I would write it down somewhere, either in a notebook or on a scrap of paper, like a Post-it note or the back of an envelope or something. And I would commit it. I'd put it on my nightstand or tape it to my mirror so I'd see it every morning, and I would commit, all right, for the next week, I'm just going to take initiative around the house. I'm not going to wait for somebody to ask me to do something. I'm going to go seek out opportunities to keep the house well organized and cleaned up and picked up after the kids and that sort of thing without being told. And I learned these sorts of things by rote. So that's the sort of thing that comes across in the book, is just if you sat down and you wrote a list of ways that not a man can be a better husband, but ways that any spouse can be a better spouse. Because this isn't about programming men to be programming a guy to be a better husband. It's not like that at all. This is things that everybody needs to work on in their marriage if they want their marriage to work out. And those are the sorts of stories that come across in the book, I think.
It's a fabulous book, and I know we got about 3 or 4 minutes left, and I definitely want to start touching on Myers-Briggs. Mr. Fincher braved it and took the Myers-Briggs. I think it was for work or something related to that.
That's right. I'm going to pull up my results. Keep going.
It's not a very brief test, that's for sure.
No, I had a real hard time with that one. My personality, I explore every possible option. So every question that came up, it said, like, would you prefer to wear a gold suit or a black jacket or something? I was like, well, both. And every question I could answer multiple ways. So I hated committing to an answer. The whole test results were messed up. Do you want to hear what they are?
Let's do it.
All right, I'm publicly disclosing this. I don't know if that is a HIPAA violation or if what, but maybe my insurance carrier is going to drop me now because I disclosed this. I'm idealistic. I'm loyal to my values and people who are important to me. I want my external life to be congruent with my values. I'm curious. I seek to understand people and to help them fulfill their potential. I am a public speaker, and I spend my whole day, all day long, just thinking about other people and why they do the things they do. So I guess this is pretty true. Adaptable, flexible, and accepting. So that one could be argued.
You got to ask your wife about that one, right?
Yeah, exactly. But no, I was willing to adapt. I was the whole Journal of Best Practices. When I find that it's important to adapt, I do. So that's good. But meanwhile, I don't even let my kids sit in my favorite spot on my couch, and there's challenges. But I don't know. I found that it was really hard to take this assessment because I didn't want to be pigeonholed into one thing or another.
Yeah, that's one thing nobody likes when they start taking these things.
Yeah.
What was the biggest shocker for you?
I don't know. I don't think anything in there was really shocking, but it did feel good to have this test, right? This formal test, tell me some things about myself that I knew that I don't think other people would assign to me as attributes. Things like, curious about people, wanting to help them fulfill their potential and that sort of thing. Like, I think if you're sitting in my audience when I'm giving an inspirational talk, you might say that. But if you were to see me around the house being a grouch, which is like 90% of the time, I don't know this. So it was neat seeing all that kind of from the perspective of the people who run the show at Myers-Briggs anyway.
Now this show, I think we're going to release this one near Father's Day. Now that I think about it, I think it's a great one to be able to do that. What's a message you want to give to husbands and spouses out there? Your last message here in the last minute.
Well, I think one of the things that I want to give, the book talks about a guy, a husband and a father, trying his best to be the best husband and father he can be. And I think that's important. But I think one of the things, the ways that you can do that shockingly is by making sure to take care of yourself. Because we have this culture where we think like, oh, we got to just please everybody. Well, take care of yourself. Focus on yourself. Don't try to change your partner. You can't control anybody anyway. You can focus on yourself. You can take ownership of your own happiness. And I think you'll see that by doing that, by engaging in the sorts of things that you enjoy, and engaging in a little self-care, that you'll actually be a much more tuned in, happier father and husband, and then everybody wins. So focus there.
That's a fabulous message. Once again, thank you so much, Mr. Finch, for being on the circle. Truly appreciate it. We thank you, everyone, as well. Here's the book, The Journal of Best Practices, a memoir of marriage, Asperger's syndrome, and one man's quest to be a better husband. David Finch. Definitely a must-read. Thank you, everyone, for joining us. Remember, our motto is simple. Wherever there's psychology involved, trying to be a better husband or not, we're going to be there. See you next time, everyone.